Sterile Processing Technicians, SPTs, play a critical role in healthcare by ensuring that surgical instruments, medical equipment, and devices are properly cleaned, sterilized, and prepared for use. Their work directly impacts patient safety, infection control, and the efficiency of surgical procedures. Maintaining strict standards of hygiene and following established protocols is essential, as even minor oversights can have serious consequences in a clinical environment. Employers look for candidates who are detail-oriented, organized, and highly committed to maintaining sterile environments. SPTs must demonstrate knowledge of sterilization techniques, infection control procedures, and proper handling of medical instruments. They also need strong teamwork and communication skills, as they coordinate closely with surgical teams, nurses, and other healthcare staff. This video provides common interview questions for sterile processing technician roles, sample answers, and practical tips to help candidates showcase their professionalism, technical expertise, and dedication to patient safety. Understanding the role of a sterile processing technician. A sterile processing technician is responsible for the decontamination, inspection, assembly, sterilization, and storage of surgical instruments and medical devices. They ensure that all equipment meets strict sterilization standards and is available in the correct quantities for procedures. This includes operating sterilization equipment, performing quality checks, maintaining accurate records, and following infection control protocols. Employers value candidates who can work efficiently under pressure, maintain meticulous attention to detail, and adhere to regulatory standards. The role also requires physical stamina, as SPTs often work on their feet for extended periods and handle heavy trays of instruments. Preparing for interviews involves highlighting technical skills, knowledge of sterilization procedures, ability to work in a team, and commitment to maintaining patient safety through rigorous infection control. Question 1. Why do you want to work as a sterile processing technician? Here's how you can answer. I want to work as a sterile processing technician because I understand the critical role proper sterilization plays in patient safety and the success of surgical procedures. I am detail-oriented and committed to maintaining high standards of hygiene to support healthcare teams and protect patients. Tip: emphasize your dedication to patient safety, attention to detail, and understanding of the importance of sterile processing in a clinical setting. Question 2. What experience do you have with sterilization equipment and procedures? Here's how you can answer. I have experience using autoclaves, ultrasonic cleaners, and other sterilization equipment. I follow manufacturer instructions and hospital protocols to ensure instruments are properly cleaned, disinfected, and sterilized. I also conduct routine quality checks to verify that sterilization cycles meet required standards. Tip: highlight hands-on experience and technical knowledge. Employers want to see familiarity with industry-standard equipment and protocols. Question 3. How do you handle instruments that are damaged or defective? Here's how you can answer. I handle damaged or defective instruments by immediately removing them from circulation, documenting the issue, and reporting it to my supervisor. I follow hospital protocols for repair, replacement, or disposal to ensure patient safety is never compromised. Tip: emphasize responsibility, adherence to protocol, and commitment to safety. Question 4. How do you ensure compliance with infection control standards? Here's how you can answer. I ensure compliance by strictly following infection control policies, wearing appropriate personal protective equipment, and maintaining a clean and organized workspace. I also participate in regular training and audits to stay up to date with the latest standards and procedures. Tip: highlight your knowledge of infection control and commitment to maintaining a safe environment. Question 5. How do you prioritize tasks in a busy sterile processing department? Here's how you can answer. I prioritize tasks based on urgency, such as preparing instruments for upcoming surgeries first, while simultaneously completing routine sterilization cycles. I maintain an organized workflow and communicate with surgical teams to ensure that essential instruments are available when needed. Tip: emphasize organizational skills, time management, and teamwork. Question 6. How do you handle a situation where an urgent instrument set is missing or unavailable? Here's how you can answer. I would immediately communicate with the surgical team and my supervisor to locate or prepare a replacement set. I would also investigate why the instrument was unavailable and implement steps to prevent similar situations in the future, such as improving tracking or inventory processes. Tip: highlight problem-solving abilities, quick thinking, and responsibility. Question 7. How do you maintain records of sterilization processes and instrument usage? Here's how you can answer. I maintain accurate records by logging sterilization cycles, recording maintenance of equipment, and documenting instrument usage. This ensures traceability in case of infection concerns and allows the department to monitor compliance with standards. Tip: emphasize attention to detail, organizational skills, and accountability. Question 8. How do you ensure that instruments are assembled correctly for surgical procedures? Here's how you can answer. I ensure proper assembly by following standardized trays lists, double-checking each instrument, and verifying that all required items are included. I also label and organize trays systematically to minimize errors and facilitate quick access during surgeries. Tip: highlight precision, consistency, and understanding of surgical requirements. Question 9. How do you handle high-stress situations during peak surgical hours? Here's how you can answer. I handle high-stress situations by staying organized, maintaining focus, and communicating clearly with team members. I prioritize critical tasks, work efficiently, and remain calm under pressure to ensure that surgical teams have all necessary instruments on time. Tip: emphasize composure, teamwork, and efficiency under pressure. Question 10. Why should we hire you as a sterile processing technician? Here's how you can answer. You should hire me because I bring a combination of technical skills, attention to detail, and commitment to patient safety. I have experience with sterilization equipment, follow infection control protocols rigorously, and work efficiently in a team environment. My dedication ensures that surgical instruments are safe, available, and prepared to the highest standard. Tip: summarize key strengths: technical expertise, reliability, attention to detail, and commitment to patient safety. Final thoughts. Sterile Processing Technician interviews assess technical knowledge, attention to detail, understanding of infection control, organizational skills, and ability to work under pressure. Candidates should prepare structured answers, demonstrate familiarity with sterilization equipment, and highlight their commitment to patient safety. Employers look for professionals who are reliable, detail-oriented, and capable of maintaining high standards in a fast-paced environment. Emphasizing technical proficiency, adherence to protocols, teamwork, and problem-solving abilities helps candidates stand out. Demonstrating readiness to handle urgent situations, maintain accurate records, and ensure instrument availability illustrates professionalism and reliability. Thorough preparation for these questions enhances both interview performance and long-term success in contributing to patient safety and surgical efficiency.